And that's exactly where things start to shift in a way most people don't expect. Because once the metabolic environment begins to change, the same medications that once barely moved the needle suddenly become dramatically more effective. It's not that the drugs have changed, it's that the system they're acting on is no longer fighting against them at every level. Think about what's actually happening inside the body at that point. Insulin levels begin to fall, not just after meals, but across the entire day. That single shift removes one of the most powerful signals telling the kidneys to hold on to sodium. And when that signal weakens, something subtle but incredibly important starts to happen. The kidneys begin to release sodium again in a way that feels almost automatic, almost effortless, as if a pressure valve that's been stuck for years has finally loosened. Now here's where it becomes interesting. As sodium begins to leave the body more efficiently, water follows. Plasma volume starts to normalize, not through forced restriction, not through extreme diets, but through a restoration of the body's own regulatory systems. And when volume drops even slightly, pressure begins to fall with it. Not dramatically at first, but enough to create a shift, enough to change the trajectory, but that's only one side of the equation. At the same time, the endothelium begins to recover. That thin inner lining of the arteries, which has been under constant metabolic stress, starts producing nitric oxide more effectively again. And when nitric oxide levels rise, vessels regain their ability to relax. Resistance drops. Blood flows more smoothly. The heart no longer has to push as hard against stiffened arterial walls. Now imagine both of these processes happening together. Volume decreasing on one side, resistance decreasing on the other. Pressure begins to fall from two directions at once. And this is where many people notice something that catches them off guard. They haven't dramatically changed their salt intake. They haven't followed an extreme restriction plan. And yet their blood pressure readings are improving in a way they've never seen before. That's not random. That's physiology correcting itself. But here's the part most people miss, and it's where things take a turn, because even when these improvements begin, the underlying system is still fragile. The metabolic pathways that led to high blood pressure in the first place don't disappear overnight. They've been reinforced over years, sometimes decades. And if the conditions that created them return, the system can snap back faster than expected. This is why short-term interventions fail so often. Someone reduces sugar intake for a few weeks. Insulin levels drop. Blood pressure improves, but then slowly, almost unnoticed, old habits creep back in. Processed foods reappear. Refined carbohydrates increase. Insulin begins to rise again, not dramatically, but just enough to restart the cycle. And because the kidneys are so sensitive to hormonal signaling, they respond immediately. Sodium retention increases again. Water follows. Pressure rises, and the person is left wondering what went wrong. The answer is that nothing went wrong in the traditional sense. The system simply returned to the conditions it was designed to respond to. The body didn't fail. It did exactly what it was programmed to do. Now here's where it gets even more complicated, because not all carbohydrates affect the system in the same way. Whole, unprocessed carbohydrates that come packaged with fiber behave very differently from refined sugars. When fiber is present, glucose absorption slows. Blood sugar rises more gradually. Insulin response is lower and more controlled. And because insulin is lower, the signal to retain sodium is weaker. But when you remove that fiber, when you isolate the carbohydrate and concentrate it, the entire response changes. Blood sugar spikes rapidly, insulin surges, and that surge doesn't just affect glucose. It sends a signal across multiple systems simultaneously. The kidneys respond. The nervous system responds, the blood vessels respond, and this is where the hidden driver of blood pressure begins to reveal itself more clearly. It's not just about what you eat, it's about how that food interacts with your hormonal system over time. Now consider the role of frequency. Most people don't just consume sugar once a day, they consume it repeatedly, often without realizing it. Breakfast cereals, mid-morning snacks, sweetened drinks, processed lunches, evening desserts. Each one triggers an insulin response. Each one reinforces sodium retention. Each one nudges the system slightly toward higher pressure. Individually, these effects seem small, insignificant even. But collectively, over weeks and months, they create a persistent state where insulin never fully returns to baseline. And when insulin stays elevated, the kidneys never fully release sodium. This is the trap. It's not a single meal. It's the constant repetition. And the body adapts to that repetition in ways that aren't immediately visible. Blood vessels become less responsive. The endothelium produces less nitric oxide. The nervous system shifts toward a higher sympathetic tone. The heart works slightly harder with each beat. None of this causes symptoms at first. There's no pain, no warning signal, no immediate consequence. But under the surface, the system is changing. And then one day, seemingly out of nowhere, a reading appears, higher than expected, maybe slightly elevated at first, maybe dismissed as stress or a bad day. But then it happens again, and again, until it becomes a pattern. And by the time that pattern is recognized, the underlying mechanisms have often been in place for years. Now here's the part that most advice overlooks, because even when people are told to reduce sugar, the focus is often placed on obvious sources: sweets, desserts, sugary drinks. But a large proportion of refined carbohydrates come from foods that aren't perceived as sugar at all: bread, pasta, rice, processed snacks. These foods still break down into glucose rapidly, they still trigger insulin responses, and they still contribute to the same hormonal signaling pathways. So someone might believe they've reduced sugar significantly while their insulin levels remain chronically elevated. And when insulin remains high, the pressure system remains locked. Now imagine combining that with stress. Not emotional stress in the abstract sense, but physiological stress: poor sleep, irregular eating patterns, lack of movement. Each of these factors increases sympathetic nervous system activity. Heart rate rises, blood vessels constrict, cardiac output increases. So now you have a system where insulin is driving sodium retention, while the nervous system is simultaneously increasing vascular resistance. Two separate mechanisms both pushing pressure upward. And this is where things begin to compound, because the body doesn't compartmentalize these effects, it integrates them. The kidneys respond to hormones. The vessels respond to neural signals. The heart responds to both. And the result is a coordinated shift toward higher pressure that feels unified, even though it's coming from multiple directions. Now here's where a critical misunderstanding often occurs. People assume that if one factor is involved, it must be the primary cause: salt, stress, genetics. But blood pressure isn't driven by a single variable. It's the result of overlapping systems interacting continuously. And when multiple drivers are active at once, their effects aren't just additive, they're multiplicative, which means small changes across several systems can produce a large overall effect. And that leads to a question most people never ask. If multiple systems are contributing to elevated pressure, which one should be addressed first? The instinct is often to target the most obvious factor: reduce salt, take medication, monitor readings. But if the hormonal drivers remain unchanged, those interventions may only partially work, and that's where frustration begins, because the effort doesn't match the outcome. Now imagine shifting the focus. Instead of asking how to reduce pressure directly, the question becomes how to normalize the systems that control it, how to lower insulin consistently, how to restore endothelial function, how to reduce sympathetic overactivation. And when those systems begin to recalibrate, pressure often follows as a secondary effect, not forced. Not artificially suppressed, but naturally reduced as the underlying drivers are removed. But here's the cliffhanger most people don't see coming, because even when everything seems to be improving, even when insulin levels drop and blood pressure readings begin to normalize, there's still one factor that can silently reverse the entire process without warning. It doesn't come from food, it doesn't come from salt, and it doesn't come from sugar in the way you expect. It's something that operates in the background, influencing every system we've talked about without being directly visible. And if it isn't addressed, it can pull the entire system back into a high-pressure state faster than anything else. And that's exactly where the next part takes a turn. And that hidden factor starts influencing the system long before most people ever think to look for it. It doesn't show up on a food label, it isn't something you consciously consume, and yet it quietly shapes how your body responds to everything else. Because even if insulin begins to fall, even if sodium handling improves, there is still a layer of control sitting above both of those systems, a layer that determines how strongly your blood vessels constrict, how reactive your heart becomes, and how sensitive your kidneys are to every hormonal signal they receive. That layer is your autonomic nervous system. Now this is where things shift again, because the autonomic nervous system operates largely outside of conscious control. You don't decide to increase your heart rate. You don't consciously tighten your blood vessels. These processes happen automatically, second by second, adjusting to internal and external conditions. And when this system is balanced, it creates a rhythm between activation and recovery, between pressure and release. But when that balance is lost, the entire cardiovascular system begins to behave differently. The sympathetic branch, often referred to as the fight or flight system, becomes more active. Heart rate increases, blood vessels constrict, cardiac output rises, and all of these changes push blood pressure upward, even if everything else in the system appears to be under control. Now here's the part that makes this especially difficult to detect. This activation doesn't always feel like stress. It's not always anxiety or panic or emotional overwhelm. In many cases, it's subtle. A background state of alertness, slightly elevated heart rate, reduced variability in how your system responds to rest. You can feel completely normal, go about your day, and still be operating in a physiologically activated state. And when that state becomes chronic, it changes how your body regulates pressure, because the nervous system doesn't just act on the heart and vessels directly. It also interacts with the kidneys. Increased sympathetic activity signals the kidneys to retain more sodium, independent of insulin. So now you have two separate systems, hormonal and neural, both telling the kidneys to hold on to sodium at the same time. And when both signals are active, the effect becomes amplified. Sodium retention increases, water follows, plasma volume rises, and because the vessels are simultaneously constricted, the pressure within that system climbs even higher. It's a coordinated response, but in this context, it's working against you. Now consider what drives this chronic activation. Sleep is one of the most powerful factors. When sleep is fragmented or shortened, the body doesn't fully transition into parasympathetic dominance, the rest and repair state. Instead, sympathetic activity remains elevated into the next day. Heart rate stays higher, blood vessels remain more constricted, and cortisol levels, which follow a daily rhythm, begin to shift in ways that reinforce this activated state. Over time, this creates a baseline where the body expects to operate under higher pressure. And because this change happens gradually, it often goes unnoticed. Now combine that with modern patterns of stimulation. Constant exposure to screens, irregular light cycles, late-night eating, and reduced physical movement all feed into the same system. They disrupt circadian rhythms, they alter hormone release, and they keep the nervous system slightly elevated when it should be winding down. Again, none of this feels extreme in isolation, but together they create a persistent signal that tells the body to stay in a more activated state. And that signal directly affects blood pressure. Now here's where things begin to overlap with what we discussed earlier, because elevated sympathetic activity also increases insulin resistance. When the body is in a fight or flight mode, it prioritizes immediate energy availability. Glucose remains in the bloodstream longer. Cells become less responsive to insulin. And as a result, the pancreas produces more insulin to compensate. So now you have a loop. Higher sympathetic activity leads to higher insulin levels. Higher insulin levels increase sodium retention. Increased sodium retention raises blood pressure. And elevated blood pressure further stresses the vascular system, reinforcing the cycle. It's not a straight line, it's a feedback loop. And once that loop is established, it can sustain itself even if one part of the system begins to improve. That's why some people reduce sugar intake and still struggle with blood pressure, because the neural driver remains active. The system is still being pushed from another direction. Now let's take this one step further, because there's another layer that sits beneath both hormonal and neural control, something that influences how sensitive these systems are in the first place. And that's inflammation. Low-grade chronic inflammation changes how blood vessels respond to signals. It reduces nitric oxide availability. It increases oxidative stress. And it makes the endothelium less responsive to relaxation cues. So even if nitric oxide is being produced, the vessels don't respond as effectively. Resistance remains higher than it should be. Now, where does this inflammation come from? Part of it is dietary. Processed foods, refined carbohydrates, and certain fats contribute to inflammatory signaling. But part of it also comes from the same factors we just discussed: poor sleep, chronic stress, lack of movement. All of these inputs converge on the same pathways. And this is where the system becomes layered in a way that's difficult to untangle, because you're no longer dealing with a single driver. You're dealing with insulin, sympathetic activation, endothelial function, and inflammation all interacting at once. And each one influences the others. Now imagine trying to address blood pressure by targeting only one of those layers. Reducing salt affects volume. Lowering sugar affects insulin. But if sympathetic activation and inflammation remain unchanged, the overall effect may be limited. And that's why progress can feel inconsistent. Now here's something that often surprises people. Physical movement doesn't just burn calories or improve fitness. It directly interacts with every system we've discussed. When you move, blood flow increases. That creates shear stress on the vessel walls, which stimulates nitric oxide production. Vessels relax. Resistance drops. At the same time, movement improves insulin sensitivity. Glucose is taken up by muscles more efficiently. Insulin levels decrease. And on top of that, regular movement reduces sympathetic tone over time. The nervous system becomes more adaptable. It shifts more easily between activation and recovery. So with a single intervention, you're affecting multiple layers of the system simultaneously. That's why its impact is so consistent. But here's the detail most people overlook. The effect of movement isn't permanent. If activity stops, those benefits begin to fade. Nitric oxide production decreases, insulin sensitivity declines. Sympathetic tone can rise again, which means consistency matters more than intensity. Now consider breathing. It seems almost too simple to matter, but it directly influences the autonomic nervous system. Slow, controlled breathing increases parasympathetic activity. Heart rate decreases. Blood vessels relax. And when practiced regularly, it can shift the baseline state of the nervous system toward lower activation. Again, subtle changes. But when layered over time, they alter the system. Now bring all of this together. Insulin levels, sodium handling, vascular resistance, nervous system activity, inflammation. Each one is a lever. Each one contributes to the overall pressure within the system. And when multiple levers are pushed in the wrong direction, pressure rises. But when multiple levers are corrected, pressure falls in a way that feels almost disproportionate to the effort. That's the part that catches people off guard, because they expect a direct relationship. One change, one result. But what actually happens is non-linear. Small improvements across several systems combine to produce a larger overall effect. Now here's where the cliffhanger begins to form again. Because even if you understand all of this, even if you begin to correct each layer step by step, there is still one final mechanism that can override everything we've discussed. It operates at the level of your blood vessels themselves, not through hormones, not through the nervous system, but through structural change. Because when blood pressure remains elevated for long enough, the vessels don't just react, they adapt. Their walls begin to thicken, their elasticity decreases, they become stiffer, less responsive, less able to dilate even when the signals to relax are present. And once that structural change begins, the rules start to shift, because now, even if you lower insulin, even if you reduce sympathetic activity, even if you improve nitric oxide production, the vessels may not respond the way they once did. Pressure can remain elevated not because the signals are wrong, but because the structure has changed. And that's where the timeline becomes critical, because the longer the system stays in a high-pressure state, the more those structural changes become fixed. And reversing them becomes significantly harder. But here's the question that changes everything. Are those changes permanent, or is there a window where the system can still be restored? Because if that window exists, then the entire approach to blood pressure shifts again. And the answer to that question is where the final part takes a completely different direction.